Good afternoon, everyone. Thank you for joining the Fight Colorectal Cancer webinar series for this September. We want to thank you all for taking the time to join us. We have a really exciting host of topics to cover today, and specifically talking about coping strategies and thinking about living with colorectal cancer after a diagnosis. And so we're excited to have Dr. Kristin Kilbourn joining us today. So we actually will just wait another 1 minute or two before, actually just a few more seconds before we continue on. We just want to remind everyone as we get ready to start for today that you are going to be muted. So unfortunately you will not be able to receive or hear the information actually real time, or you will be able to hear the information, but in terms of asking questions and the like, we will go ahead and reserve the chat function. So you will go ahead and type any questions or comments that you have that we will actually try to get to the presenter post the discussion so that we can ask questions real time today, but it won't be necessarily in a dialogue fashion. So again, thank you so much for joining all of us today. We're really excited about what we're able to offer. So Michael, next slide. So again, today's webinar is Dr. Kristin Kilbourn, and then we're all just a quick reminder that we will be archiving these webinar series as well as this month's, as well as what we've covered in our previous months and topics at the Fight Colorectal Cancer website. And please spend any amount of time in forwarding information and providing information to fellow survivors and co-survivors about the resources and materials that are available to all of you upon your request and when you have availability. We will be actually post-webinar, for those who've registered today, send an email with the links to the materials that Dr. Kilbourn has provided to us, as well as providing a little bit of information around the topics, your satisfaction with materials and information we're bringing to you. And as a thank you, we'll provide a Blue Star pin. And again, just a reminder that on the right side of the screen where we'll post any questions. And of course, social media is a lot of what we do. So following us on Twitter, it's #CRCwebinar for any information about the webinar topics that you'd like to tweet or ask questions or provide additional comment. Next slide. Then the next thing I just want to quickly talk about is that many of you know that one of our much acclaimed and one of our biggest resources that's new with Fight Colorectal Cancer is our Guide in the Fight, which is a late-stage guide for stage 3 and 4 colorectal cancer survivors that really focuses on a lot of information and insight about the real walk with all of you as a diagnosis and a later stage diagnosis, the pragmatic detail information, background information, even materials that might be helpful in terms of interfacing with medical providers. This is available online at our website that's listed there, and we will be going and making additional updates and making this tool available. But we're very proud of this resource and want to make sure that, of course, that we can get this out to as many folks as possible to be a true resource for those of you who are you know, really in this point of needing resources and access. So just a reminder that we do have a bevy of materials that are available on our site. Next slide. I'd also then like to just remind all of us that one of the biggest aims for Fight Colorectal Cancer is really looking at later stage cancer and also thinking about how do we really progress survivorship and increase survivorship, and thinking about what are the aims and research that we can do to really extend and think about quality of life and approval of survival for those who are diagnosed with stage 3 and 4 colorectal cancer. And so the LISA Fund, which was established in 2006, is really an innovative means for us to think about progression of resource. And so just reminding that a lot of the donations as well as the donorship and sponsorship is really devoted towards progression of the research aims. And so just a reminder that this is a lot of the work that we're really dedicated towards here in terms of Fight CRC and our devotion to research. Next slide. I just want to also remind everyone that in terms of the disclaimer for today, that this is in no way or shape or form meant to replace direct medical care or to necessarily replace a doctor or a provider's interaction with you, or even interfere or with any of the medical plan that's set forth. Rather, that this is actually the information that we're providing through Fight Colorectal Cancer is really to help supplement the materials and the information that if there's ever a time that you do need specific resources from a medical provider, we do ask that you do make connection with those individuals, and of course in an emergent situation, use 911 or an emergency room. So this is a lot of the work that we're doing, again, is supposed to be in support, and we don't specifically endorse or ever recommend any specific treatments, physicians, or the like. That's really at the purview of the discussion with the patient and the physician interaction. Next slide. I did want to actually then, of course, before we do introduce our speaker, Dr. Kristin Kilbourn, I know that today there are actually several questions that our team hope that you might be able to answer through our polling device that's actually enabled through the webinar series, where we'd like to know a little bit about where you are in your as a colorectal cancer survivor, what stage, and then a little bit about what is your experience in terms of coping and how you feel that you're able to really cope as well as deal with the issues that have been brought forth since a cancer diagnosis. And Dr. Kilbourn has provided a couple of questions that as we get ready to start our presentation today, that is actually ready to go. We ask that you take just a few seconds to go ahead and fill out this information before we even get started with the discussion. But in that meantime, I would like to introduce our speaker today, who's actually a colleague of mine here at the University of Colorado Cancer Center and the Colorado School of Public Health. And Kristin and I have actually worked a good bit on a number of cancer survivorship projects and initiatives. And I would say is probably one of the leading experts in psychosocial care and program development, which I was very excited to have her join us with Fight CRC to have a bit of discussion about coping strategies and thinking about the impact of colorectal cancer going forward. So Dr. Kilbourn is an assistant professor at the Department of Psychology, working very closely with clinical team, even at University of Colorado Cancer Center, as well as a number of hospitals and institutions throughout the country and state. She is, of course, a member of our Cancer Center, and she does hold a faculty position in the Division of Internal Medicine. And I will tell you that in working with Dr. Kilbourn, she's been phenomenal in helping think of program development design and even helping a number of community centers, agencies, and organizations really think about how they work with cancer survivors and really improve quality of life. So we're very honored to have Dr. Kilbourn with us today. And I'd like to go ahead, Kristin, if you're ready to take the reins, I will have you take over.
Great. Well, thank you, Andy, for that very nice introduction. Just for all of you, you may not be familiar with the area, but I'm a clinical health psychologist. And as Andy mentioned, my research area of clinical and research expertise has been in working with cancer survivors and developing programs, psychosocial programs for cancer survivors. So I'm happy to be here today to talk about some of the issues that cancer survivors often deal with, as well as oftentimes families and caregivers. So I also do a lot of work with families and caregivers. So hopefully my slides are now connected. Just to give you an overview of things that I was going to talk about today. So I want to just talk a little bit about kind of an overview of some of the psychosocial issues that come up as living as a colorectal cancer survivor. And then I want to talk about how you might recognize the signs or symptoms of distress or significant distress. So we'll review some of the symptoms of depression and anxiety. And then at the end, I wanted to really provide some good practical information, so hopefully you would leave here with maybe some new ideas about coping or things that you could do to help you manage some of your distress or psychosocial issues that you may encounter or you've been experiencing. So first, I want to talk a little bit about how we often view, hopefully we're on now, how oftentimes as a health psychologist we tend to think about illness. So oftentimes when someone is struggling with, they've been diagnosed with a major illness, been diagnosed with cancer, or they've gone through treatment for a different type of illness, we think about it as just, you know, a major life event. And oftentimes a good predictor of how someone is going to do and adjust to that is how they've done with other big major life events in the past, if they've had some. So we know that with any major life stressor, there's oftentimes uncertainty, stress related to uncertainty about the future. Oftentimes there are multiple losses that people may experience. Some of these may be short-term, some of these may be more long-term adjustments. So things like independence and control. There may be some functional losses or problems. Financial loss, unfortunately, is very common. And then also there are oftentimes changes in one's role within the family. Again, this may be something that is temporary while someone may be going through treatment or recovering, but it can be a significant stressor nonetheless. Now, when we think of from the psychosocial standpoint of how individuals tend to adjust to cancer survivorship, we sort of break it up into different areas. So if we look at that first box there, the green one on the left, just going through screening can be very stressful, especially for people who are cancer survivors. But even people who are not cancer survivors, just having to go in for a colonoscopy or different screening tests can be very stressful, associated with a lot of fear, anticipatory anxiety, etc. And then, as all of you know, or all of you who are cancer survivors who are on this webinar, then there's the stress associated with diagnosis, which is often different types of things that cause stress here. So oftentimes it leads to a lot of life disruption. What am I going to do? How am I going to continue working as I'm going through treatment? What about my roles in the family, things I need to do? Lots of decisions. Oftentimes people feel very stressed if they have to make decisions about what type of treatment, where am I going to have it, when am I going to start, those sorts of things. It also can be very stressful for a lot of people. It's the first time that they've actually had to face their own mortality or even think about that. So it brings up a lot of issues around that. And then just the issues of loss, whether it's functional loss or changes that may result because of their diagnosis. And then we have the pink box there, which is treatment. And, you know, interesting, a lot of people, oftentimes, a lot of the psychosocial stuff or the real emotional stuff kind of get put to the side during treatment, because what I found is a lot of people really need to just focus on getting through treatment if they're going through a pretty difficult treatment protocol. So there's more of a focus on the physical, you know, quality of life, how do I manage my symptoms, those sorts of things, the side effects, things like that. But during this time, it can be very lonely for a lot of people, because oftentimes they may feel socially isolated. Let's say they need to take time off from work, or they're not able to participate in activities that they really enjoy and love and bring them a lot of joy in their life. So it can be very, very stressful. Although oftentimes there's a lot of that emotional stuff that people just aren't ready to deal with while they're going through treatment. They're just trying to get through it. Which then brings us to the yellow box, which is, I want you to think of, you know, kind of at the end of treatment and then continuing forward as into the early stages of cancer survivorship. And this is the time where lots of people don't anticipate experiencing high levels of distress, but that's something that we often see, and it's also been shown in research. Oftentimes, there are a couple of reasons for this. One reason is that, as I mentioned, there are a lot of emotional things that may be kind of put to the side as people are just trying to get through treatment that then come back up again once they're through treatment. There's also a lot of distress associated with, okay, I got through treatment, but what now? All of a sudden, all this uncertainty and that sort of existential struggle to figure out, okay, I've been changed by this. I'm not the same person that I was before I was diagnosed with treatment, and what do I want to do, or with cancer? What do I want in my life? What's really important? So there's the uncertainty. Oftentimes this is a time where people become much more vigilant, much more attentive to any physical symptom, which can cause a lot of anxiety. Is that something I should be worried about? Why am I still feeling so tired and fatigued even though I'm finished? What's that pain or that ache? Should I be worried about it? So a lot of anxiety and distress. There's also, this is oftentimes when the bills start coming in and people start realizing, oh my gosh, I've got some economic stress along with everything else. So oftentimes when I work with people, or what we hear is that there's some surprise. People don't recognize why I should be happy. I'm finished with treatment. I can go on with my life. Why am I feeling so anxious, or why am I feeling so depressed? And some of these feelings can continue on for long, long after the completion of treatment. Now, I just want to mention, many of you have probably seen this or are aware that we're seeing the number of cancer survivors going up. It's up to at least 13.7 million cancer survivors in the U.S. That's going to continue increasing, which is good and bad, I guess, in two ways. But I think it's also important for us to recognize that, as I have it here, it's not just that you live, but it's how you live. So it's how to find that quality of life and making sure you're making the most of that. So I always emphasize that when I talk about the increased number of cancer survivors. And oftentimes people get through treatment and they're doing great in terms of their cancer. Their tumor's gone, they may have no evidence of cancer, everything looks great, but they may be still experiencing a lot of the psychosocial consequences of that very stressful event. In terms of just going back for a minute to the end of treatment, I think I've always been very interested in working with cancer survivors around this time because I see it as this unique opportunity that it can be very difficult and very stressful, but it can also lead to a lot of positive changes in people's lives, because this is a time where people often kind of take stock of where they are in their life, and then they're deciding what's really important. This is why I love working in the clinical sense with people who are at this stage, because I see tremendous changes, positive changes that people make in their life as a result of going through this very difficult experience. So, you know, whether it's job, career, family changes, some people move. It's sort of a time where people say, you know, why am I waiting anymore? I'm going to make these changes that are going to make me happier, improve my quality of life, get more joy in my life. So it can be a time of a lot of growth. But as I said, it can also be a very difficult time when you're making those kinds of changes. So oftentimes the distress that we see is that loss of a safety net. So when you're going through treatment, you feel like there's a team of doctors and your medical group and your friends, and you've got a team that's really working on focusing on helping you get rid of this cancer, do the best to improve your physical health, and then suddenly you're done. And you feel like you're just kind of floating out there by yourself, and it can be a very scary feeling. And then it's also for oftentimes resuming roles and going back to work or going back full-time or resuming some of the things you were doing with your family and your friends. That can be hard. And then there's always the lingering symptoms, physical symptoms, some which may be long-term, some may be short-term, but that can also have an impact on quality of life. I think I talked a little bit about that. But just to emphasize again, this really can be a time also of amazing growth for a lot of people. And as I mentioned that last one, yeah, often survivors are surprised by how they feel at the end of treatment because of all these things that are going on. And I do want to mention, as I said earlier, I do a lot of work with families and caregivers also. And so I always conceptualize, want to talk about, you know, cancer or any major medical illness, it impacts the whole family. So there's one person who's dealing with the direct effects of going through treatment and diagnosis, but everyone who cares about that person and is in their social circle is also impacted. So it has an impact on relationships, family roles, financial issues, and just the way the family or other people may conceptualize future plans and dreams. So it really can place a high level of stress on the whole family unit. And when I say family, that also includes friends, the whole social network for someone. So that was a little bit of background. Now I want to talk a little more specifically about what are some of the signs or symptoms that, you know, with my clinical hat on as a psychologist, that I would want people to pay attention to that may be a sign that, you know, they may need to think about doing something, some type of intervention, talking with someone, something like that. Because oftentimes there's some confusion about kind of when is it significant, when is it time to seek help or support. So let's talk first a little bit about the symptoms of depression, okay? So certainly most people think of, oh, depression is about feeling sad and maybe crying more and just a sadness, maybe helpless, hopelessness. But I also want to point out that you could be depressed and not necessarily sad. So certainly there are some people that their depression may present much more with an anger and irritability, and they may not identify themselves as being depressed, but certainly they could be depressed. So just I want everyone to realize that you could be depressed, but you may not have that sort of what we think of as sadness all the time. It could be more anger or irritability. Then also to recognize that depression has a whole range of somatic or physical symptoms also that oftentimes are confused with other things, especially for cancer survivors, where you may be dealing with some fatigue after post-treatment or long-term problems with fatigue or chemo brain or things like that, that make it sometimes difficult to identify that some of this could be depression. So for example, problems with sleep, very characteristic. People who are depressed, it could be insomnia, problems falling asleep. It could be what we call waking in the middle of the night, having problems getting back to sleep, sort of that 3 a.m. kind of waking. Or it could be waking earlier in the morning than they wanted to. So sleep problems. And then there are some people, although these more common, it's problems sleeping, but there are types of depression where people sleep too much. So be aware, changes in sleep, that could be a sign. Appetite. So again, typically the typical depression is a change in appetite where, you know, the food, just you're not as interested in food. Things don't taste as good. You're not excited. Foods that you usually would really enjoy aren't very interesting to you. This could be accompanied by weight loss. Again, there are the more rare types of depression where it's overeating and weight gain, but typically it's more decreased appetite. And then low energy and fatigue. So depression can also be related to low levels of energy. So sometimes it's a combination of things going on if someone's experiencing low levels of energy. And then there are also cognitive symptoms that go along with depression. So problems with concentration and memory, problems being able to focus. So again, that's one that people don't typically recognize or think of as depression, but I just want you to be aware of. Now, usually when we diagnose someone with a major depression, we're going to look for a number of these symptoms. But I just want people to be aware of some of these symptoms that they may have never thought about that could signify that they're depressed.
Kristin?
Uh-huh.
Hi, it's Michael. And speaking of depressed, I think our display of the PowerPoint is not quite working as we had hoped. Your screen is kind of like squished.
Oh.
On the presentation. If it's okay, I'm going to take over as the display, and just let us know when to go to the next slide.
Okay.
So everybody can see it, because you've got some really great stuff here.
Okay. should I connect back to the webinar?
Nope, I'm gonna just take over as the presenter really quick.
Okay.
And just give me a second.
And while Michael's doing that, thank you so much, Kristin. I just want to remind everyone too that we are entertaining questions on the side panel. So if you have any specific or thoughts or questions that you'd like us to address towards the end of the webinar, this is a good time to write those in so that we can insert those. And then, of course, post-webinar, we'll also have that opportunity to gather that information as well. So I think we've got the slides back up and running here.
We're good.
Thank you. Are they up now? Great.
Yep.
So, yeah, it's hard not being able to get feedback. But yes, if you have questions or any thoughts, please let us know. And at the end, I'll also give you my email so you can contact me directly. Just in terms of some other things with depression, decreased interest in previously enjoyed activities. This is a big one for me when I'm working with someone and trying to assess their depression. When you just, say you have hobbies, things that you love to do, and you just don't have any motivation or interest in them at all. This could be, often this is a really important sign for me. And then sometimes it's feelings of worthlessness. And then, of course, at the extreme is having thoughts that life is not worth living, that you'd be better off dead, suicidal thoughts, even plans. That's certainly something, if you ever have anything like that, please get professional help. There are great crisis lines, great support out there, just to recognize that. Then just to talk a little bit about anxiety. So I think anxiety is one of those that most of us can relate to, and the symptoms are a little more things that we do tend to think about. So obviously the excessive worry, feeling restless or on edge. Also fatigue can play a big role in anxiety. When we're really anxious and nervous, as you might imagine, we burn a lot of energy. And so it's oftentimes, it just exhausts us. So fatigue, also concentration and memory problems, again, similar to depression, where it's very hard to focus. What tends to happen when people are anxious is that a lot of information never makes it to the long-term memory. So they experience problems with memory, can be lots of irritability. Sometimes people really get it in their body, a lot of muscle tension, muscle aches. Could be GI, sometimes it's like feeling like you have that knot or just something in your stomach sitting there. Sleep disturbances also are very common, tends to be more, trouble falling asleep or waking up in the middle of the night, and then your mind is racing, what we call rumination, where you just can't get off a topic, or you're worrying about something and you just can't get off of it. And then we also have, sort of separate from what we think of as general anxiety, and people can certainly have both, are when people are experiencing panic attacks. And it's funny, I'll sometimes ask people when I'm meeting with them, have you ever experienced panic attacks or anxiety attacks? And when they respond, well, I don't think so, I don't really know what that is, I usually say, you've probably never had one. So, panic attacks are very uncomfortable if you've ever experienced them. Typically, you'll know if you've had one. Racing heart, a lot of physical symptoms. A lot of people end up in the ER when they're having panic attacks, or at least if it's maybe the first one they've ever had, because it can feel like you're having a heart attack or something's really wrong. Some people have this feeling like they're going to die, the world's sort of caving in on them. So just to be aware, and sometimes they can last up to 30 or 40 minutes. So a lot of different physical symptoms. I will say on the positive side, we have some great treatments, and even without medication, that can really, in cognitive behavioral therapy and other types of psychotherapies that are really effective for anxiety, especially panic. So I always tell people, if you're really experiencing a lot of panic symptoms and it's impacting your quality of life, really encourage people to go get help, even self-help. There's some great books and things like that, but just to know that you don't have to suffer with that. So how do you know when to seek help and support? So this is a big question. You may be thinking, I've had some of those symptoms, or maybe I know someone who has, but when do you know when it's time to really think about getting some help? So I say, the first one is it interfering with your day-to-day life, right? You're not sleeping well, so, you're grouchy, you're not very effective during the day. You've noticed your quality of life has really decreased. You're not going out with friends, you're not engaging in activities you used to enjoy, you're avoiding places where you feel more anxious, and that's impacting your life. Maybe your friends or family or coworkers have noticed a change and mentioned something to you that they're worried, or they've mentioned that your mood's a little low. You're not experiencing joy in life. I think it's always good to do, every now and again, just sort of ask yourself, am I enjoying my life? Am I doing the things that really bring me joy and happiness? Experiencing that. Of course, as I said, if you're ever having any sort of thoughts that life is not worth living, or that you'd be better off dead, that's a significant sign to seek help very, very soon or immediately if you're having real suicidal thoughts. So just to talk a little bit about some of the different types of interventions, or if you were to seek help, the kinds of things you might consider. So certainly there are what we think of the psychotherapy or talk therapy types of programs. As I mentioned, cognitive behavioral therapy is really one of the best evidence-based treatments for depression or anxiety, very, very effective. Usually we put it in sort of the brief therapy category. So usually, for most people, 12 to 16 sessions. It's all about teaching skills, so then you can go and use those skills on your own. Existential therapy can be very helpful, especially for people that are kind of at that point, sort of post-treatment, trying to figure out what kind of changes, what kind of changes do I want to make in my life, and what sort of things bring meaning to my life, and what kind of things do I need to change to have more meaning in my life. And then there's supportive therapy, just having someone who can talk with you and provide some feedback. Also recognize that there are a lot of great mind-body interventions that can be very helpful. We have some good evidence base for depression and anxiety, more the milder type depression, milder depression or anxiety. So different types of relaxation interventions, which are especially good for anxiety. Yoga, meditation, I really like these types of interventions for people, especially good for anxiety, kind of help ground you, teach you some deep breathing, kind of help you meditate, focus on things away from your worries. For some people, spiritual interventions can be very helpful and very powerful. Support groups can be great. I know that, some people really like groups and some people are not group people. So that's okay if groups are not your thing. Don't feel pressure that, oh, there's all these cancer support groups, I really should be going. And I always say, with a word of caution is with groups, it's also important to at least recognize that peer-led groups may be quite different than professionally led groups. So sometimes with peer-led groups, if you have someone leading a group who doesn't have that type of experience in just group dynamics, they can be a little more sometimes distressing for people. So I always say, for people, maybe steer them a little more to unless you know a lot about the peer-led group, the professionally led groups usually are a little more structured and have people who are trained in how to handle different group dynamics. And then, of course, there are also the medications. So, especially for people who are really in the more moderate to severe range, say for depression, we know that oftentimes a combination of some type of talk therapy and medication may be very helpful. For anxiety also, there are some medications that can be helpful, although I really recommend that that would be in conjunction with some kind of psychotherapy, because some of the medications that are used for anxiety are very good for the short term, but they're not something that you want to rely on long term. So just to be aware of that. And as I said, there's some great cognitive behavioral therapy usually works very well for anxiety. Also, I just want to mention too that for a lot of people, just having someone, you know, I see people sometimes that I just see a couple times that just need to be able to come in, and we're going to talk a little more about coping skills to help me sort of direct them in a way of things that can be more adaptive for them. So sometimes it doesn't need to even be a big commitment. Just going in and talking with someone just for a couple sessions to kind of get you back on track can be really helpful. So I want to shift a little bit and talk more practical in terms of some of the strategies that even for those of you who maybe haven't, you know, experienced really significant levels of depression or anxiety, but just talk about good skills, things that are good for all of us in terms of maintaining good emotional and physical health. So I'm going to talk a little bit about stress management techniques, communication, adaptive coping strategies, effective use of your social support system, a little bit about healthy behaviors, and then how to kind of come up with your own self-care plan. So let's talk a little bit about stress management. So we certainly know that we can't control the stressors in our life, but we can control how we respond to them, okay? We know that stress really can play havoc. I don't think I need to convince anyone of that on all different areas of our body and our being. So from the physical, our physical health or physical symptoms, to cognitive, emotional, social, etc. And cognitive behavioral techniques are very effective in helping people identify when some of those thoughts that are associated with different types of stressors may be distorted or a little bit out of whack. So it really helps people help to recognize those distortions and make those thoughts more accurate, which then has a positive impact on both emotional, physical health, as well as our behaviors. As I mentioned, also relaxation and engaging in pleasurable activities are very good for stress management. What happens to so many of us is that we have some big major stressor, even things that are, you know, seen as positive, but stressful. You know, we know that marriage and moving are two of the big ones. But we kind of stop, we get so stressed and so busy that we actually stop doing all the things that are really good for us to help us manage that stress. We might not exercise on a regular basis, where our diet isn't as good. So you really want to think of when you're dealing with a lot of stressful kinds of things going on in your life, that's when you really want to make sure you're taking good care of yourself and you're engaging in pleasurable activities and maybe engaging in some of these other activities that I have listed here. Now, communication is also something that can cause us a lot of psychosocial distress, and communications are very common in families and also with friends, especially when someone's dealing with some type of major medical issue. So it can include everyone who's within, when we talk about communication, everyone that's within your network, social support network. And it's just oftentimes really helpful to just think about these strategies that often we don't always think about. You know, when you have something important to communicate with someone, make sure you set aside that time to talk with them. It's not just sort of an add-in quick thing when it's something that's very significant. Sometimes it's helpful to make an outline or list, make sure all the things that you want to say or you want to talk about are covered. This can be very important, especially when you're dealing with your medical practitioner. When you come in and you have your short little appointment and you have all these questions or things you want to check in on, it can be helpful to have those written down so you make sure you get to all of them. Use assertive communication, so I statements. I feel is usually a good one if you're communicating some difficult information to someone else. If you use an I feel statement, they're less likely to become defensive. It also allows you to really express what you're feeling in a genuine way. Utilizing good listening skills is always important too. So everyone likes to know that they're being heard. So reflecting back what you're hearing from them, that's a great skill, because sometimes what you thought you heard may not be exactly what they were trying to tell you. So then you can find those inconsistencies and correct them. And then also being sure not to jump to conclusions or making assumptions about things. Having worked with both sides, with caregivers and with cancer survivors, it's always interesting because you'll hear from cancer survivors a lot, like, all my friends were so great and supportive when I was going through treatment, and then when I was finished, they all just sort of disappeared. What happened? Like, no one seems to care anymore or realize how hard it is for me still. Well, guess what I hear from the other side? I hear people saying, you know, I just don't know. So when they were going through treatment, I knew what kind of support I could give and call them and take them food or take them places or do whatever I thought that they needed. But now I don't know. I don't know what to say. I don't know what to do. I don't know what's helpful. So I just haven't talked to them for a while. So it's always important to not jump to conclusions or make assumptions. Better to just ask. Okay. So I wanted to talk just a little bit about coping skills in general. And this is can be, I think, something that's really helpful for everyone when you're dealing with any kind of stressful situation. So understanding that coping, we all have different ways we cope with stress. Some of them are good or helpful. We call those adaptive. Some of those might not be, in the short term, they might seem like they're helpful, but in the long term, they're not good for us. We call those maladaptive coping strategies. And talk a little bit about thinking a little more when we're dealing with the stressor on what might be the best, most effective coping strategy. And so it's really simple the way oftentimes we kind of conceptualize coping. And it really has to do with matching the situation to the type of stressor. So if you think of a situation that you might be experiencing, a stressful event, for example, let's say a big stressor for cancer survivors is when they're going in, they're due for your however often, annual or every 6 months or however it's set up, to go in and have if it's blood tests or it may be bone scans or CAT scans or whatever it is for you, that sort of surveillance follow-up following your cancer treatment. This is a time of really high anxiety and stress for almost all cancer survivors. So if you think of that situation, you can think of there are some aspects of that are controllable, right? You choose, you have some choice of when you're going to go in and where you're going to go, and are you going to bring someone with you, that sort of thing. How do you prepare? But there are a lot of pieces of that stressor that are beyond your control, right? Worrying about going in for those tests isn't going to change whatever the results are, right? Part of that is just beyond your control. You just don't know. And I wanted to mention this because the way that we deal with the controllable aspects of stressors are quite different than the types of responses, coping that we use for uncontrollable types of stressors. So for those kinds of aspects of a stressor that are controllable, we use what is often called problem-focused coping, which makes sense. If you have some control over something, then you can problem solve it, use decision making, get more information, set goals. It makes sense. So you can actually change some aspects of the stressor that are controllable. When you're dealing with uncontrollable types of stressors, we know that problem-focused coping usually isn't very helpful. Sometimes it causes more distress, right? So we recommend what we call emotion-focused coping. This is a way that allows you to recognize or that you have some distress associated with these stressors or the stressor, and you want to engage in activities that are going to allow you to get some of those emotions out in a healthy way. So sometimes it can be talking to other people. Psychotherapy is a great example of this. Could be close friends, people that you can talk with, just express some of how you're feeling, your fear, you're scared, that sort of thing. Sometimes it's how to reframe the situation. There are different kinds of really creative activities that can be very good. People who, if you like artistic things, painting or sculpting or photography, journaling, music, all of those are very good emotion-focused type of coping strategies. Some people like to exercise, do some kind of activity, get out in nature, go hiking, those kinds of things. meditation and spiritual practice can be very helpful. And then just engaging in, hobbies and activities, things that you enjoy, that just give you a break from your worries or trying to fix something that you can't necessarily fix. This is sort of a this first column. You can really see some of the things we talked about, what we call the adaptive coping strategies. What I want to draw your attention to here is where you see the kind of funny face on the bottom, the passive or the maladaptive coping strategy. So just to be aware, the kinds of things that aren't so good, but that we sometimes do when we're undergoing a lot of stress, could be that sort of behavioral avoidance or denial, not wanting to think about it. I will say that I think denial can be okay in the short term. Sometimes we're just not ready to process something, but in the long term it can cause a lot of problems. So just to be aware of that. And then of course the things like, smoking, eating too much or eating unhealthy foods, drinking too much alcohol, could be not taking good care of yourself, so you're not taking your medications, you're not going to your doctor, you're not being very adherent, you're holding in your feelings, those kinds of things. So being aware of that, those are coping strategies too. They're just not the most adaptive coping strategies. So, if you're doing some of these things, the more maladaptive passive, think about how can you move up to instead using some of these more active adaptive coping strategies. So just in general, I want the takeaway message from the coping skills is that to recognize that there are a variety of different coping techniques that you can use. So looking back at those last two slides and recognizing sort of the more kinds of coping strategies that you have available to you, the better that will be. And that it's important that you match the stressor to the type of coping response. So thinking about what aspects are controllable, let me use my problem-focused coping strategies, and what aspects are uncontrollable that problem focus is not going to work very well on. What are some emotion-focused coping strategies that I might think about integrating? So really important. And most of us are not evenly balanced. So recognize that if you're a more analytical type of person, you're probably a really good problem-focused coper, but maybe you need to work a little harder on developing those emotion-focused coping strategies. And then there's some people that are really good with emotion-focused but need to work on their problem-focused skills. So usually we're better at one than the other. That's pretty normal. Yeah, which is that. Okay, so social support I want to touch on. I'm sure you're all really aware of the importance of our social connections. If you look at, not just for cancer, but if we look across the health psychology research literature, this is one of those things that always really comes out as very important. And I always stress that it's not about quantity, it's about quality. So if you just have a couple people in your social support network that can provide you with the type of support that you need and that is important to you, that's great. There's certainly people that have large social support networks, but they don't feel like they have a strong connection with anyone in that network. So part of social support is first being able to utilize your social support so it helps you with your emotional and physical health. So knowing how to ask for support. As I mentioned before, my experience working with both sides, caregivers and family and friends of cancer survivors, usually it's not an issue in wanting to give support. It's more of, I don't know what to do. I don't know what I can do to be helpful. I don't know what to say. I don't want to overstep the boundaries. So again, it's best to be able to tell people. People are much happier when they know what they can do that will be helpful to you rather than trying to guess. Knowing who to ask for support. So again, there's a matching that goes on, recognizing that there are different types of social support. There are some people, some of our friends and family that aren't so good with the emotional support. You try to talk to them about something heavy or how you're feeling and you just don't get a great response, or they try to fix it when it can't be fixed. But they may be great at providing tangible support. right? They may be the ones you call on to say, hey, would you mind running to the grocery store next time you're there and picking up a few things for me, or running to the pharmacy and picking up a prescription or something like that? So recognizing that. And then there's some people who are really good at informational support that, you know, might not be so great with emotional, but you say, hey, would you mind looking this up for me, getting some more information about this type of treatment or this, whatever it may be, and they're great at that and they love doing it. So recognizing that there's a matching process here. Sometimes it's not that you don't have social support, it just may be you're asking the wrong people for what you need and you just need to rethink that. Also thinking about, you know, you may feel that you want to have a larger social support network. So thinking about different ways to do that. So we talked about support groups. There's all types of support groups out there. They don't even need to be cancer specific. So you can also get some support if you're professional support. Trying new activities or hobbies are a great way to meet people, or even just getting more involved in something. You know, if you love to hike, there's all kinds of meetup groups or hiking groups where you can meet new people. You know, sometimes people, you know, great way, like just decide you're going to start to learn how to play an instrument, you know, and take classes in that and meet people, or art classes or meditation class, yoga class. Those are all great. So just be thinking about if that's something you're considering that you want to improve your or increase your social support network. There are a lot of different ways to do that. And as I already said, quality is the key. It's not quantity, it's quality. I just want to I'm not going to spend much time on this, but I want to go back just for one moment when I talked about how I really enjoy working with cancer survivors, especially close to that time when they're in that early stage of cancer survivorship, because I always feel like there's this unique window of opportunity, not only for a lot of growth from the psychological standpoint, but a lot of potential for growth and making big changes also in health behaviors. So oftentimes it's a time where people really start to think about, maybe it's time I start getting on that exercise plan or making those changes to my diet that I've been thinking about. Because we know this is so important, especially for cancer survivors. We have some really good evidence now that, you know, maintaining a healthy diet, a healthy weight, exercise, really limiting things like alcohol, making sure you're getting good sleep quality is really, really important. So just to be aware of that and really be thinking about these things, which can not only impact positively on your physical health, but really play a huge role with emotional health also. So when you're thinking about good self-care, this is what I want everyone to always be thinking about. Am I taking good care of myself? How is my self-care? What does this mean? This means putting yourself first. And this is a hard one for a lot of us, but recognizing that before we can take care of all the other people in our lives that we care about, we need to take care of ourselves first, okay? Maintaining good health behaviors, sticking to your medical regimen, whatever it may be, whatever's been recommended for you, engaging in those pleasurable activities. I mean, ideally, you should have something every day in your life that you enjoy, even if you don't have a lot of time that you can do. Sometimes you have to plan for those things, and finding balance in your life. And I often talk with cancer survivors about this idea of thriving, okay? It's not just surviving, it's about thriving. How do we take this experience of going through cancer and cancer treatment and maybe living with cancer, and how do we thrive given those circumstances, okay? So one is always to be asking questions, getting involved. Those of you that are on this webinar or listen to it later, it's great. You're already thinking about this. What are some things I can do? How can I make improvements in my life, improve my quality of life? What can I do to improve or maintain my mental and physical well-being? Where can I find the support that I need? Okay. Sometimes it's really helpful to actually develop a plan. Think about these different aspects of your life, my physical health, my emotional, social, and spiritual needs. Am I meeting those am I balanced in all these areas, or maybe I'm a little out of balance and I need to think about changing some of these things. Seek out help when needed. So hopefully at least that quick overview we did of depression and anxiety gives you an idea of, you know, when you might want to actually seek help, whether it's professional help or seek help, be able to talk with people within your social network or medical practitioners. And really making it now, you know, recognizing that this is the time, right? Rather than putting it off and waiting, now's as good as any time to really start working on making these positive changes in your life. So this may mean changing some of your health behaviors, adopting more healthy behaviors, practicing those adaptive coping skills that we talked about, reprioritizing what is really important in your life. This can be an incredibly powerful exercise to just be able to sit down and think of what are the things I really value in my life that bring joy and meaning to my life, and then how am I engaging, or am I engaging in these kinds of things? Is my life in touch or connected with what I really value, or maybe I need to make some changes, reprioritize some things. So I always end my talks when I'm talking about these things to recognize, I love this saying, the bend in the road is not the end of the road unless you refuse to take the turn. So as I mentioned, I think that, you know, being a cancer survivor there are certainly a lot of challenges with that, but it can also lead to a lot of positive growth and a lot of positive changes in your life. So it's just being able to recognize that path is there and finding that path. So I want to thank you all for your attention. Hopefully this was helpful. And also to give you my email address if you have any questions or things come up. Hopefully at least this will give you some ideas or things to be thinking about. I know we talked about a lot, but and I welcome your feedback. So thank you very much.
Very good. Thank you, Kristin, so much for your time, Dr. Kilbourn. It's been super helpful. We have just a couple minutes for some questions, and for those that we don't get to today, we'll definitely follow up as well. And so I think, Kristin, one of the first questions was specifically if you are someone who's looking for professional help, is there a specific location, website, directory that lists clinical psychologists or social workers who specifically deal with counseling for cancer survivors?
So the American Psycho-Oncology Society, APOS, and this is hopefully something we can make available to all of you, this website. They have a service. You can go on their website, and I believe you can put in like your zip code or something, your area, and they will give you a list of mental health practitioners or people in that area, in your area, that work a lot with cancer survivors. So that's one way. I'd also say, you know, that most health psychologists, you know, are really great at working with people with all different kinds of illnesses, including cancer. So in terms of psychologists, another thing that you can do, depending on what state you live in, every state has their own psychological association. So, you know, it's usually ours is CPA, Colorado Psychological Association, Florida's FPA. Usually you can find it pretty quickly by Googling. And oftentimes they'll have a place where you, again, can put in like your area code, and then you can put in specific things. So you can put health psychology, you could put in oncology, you could put in cognitive behavioral therapy, different kind of keywords, and they'll help you connect with people in that area.
Okay, great. And I know we have some other questions that might be more discreet about coverage, insurance for some of the supportive care, which we can probably just provide a little bit of insight. But there was a specific question around thinking about relationships as well as thinking about for married couples, and any tips specifically to think about coping strategies that really are supportive for both. And if you see any work best for caregivers versus survivors and vice versa. So I think that the biggest, question is, are these approaches really applicable to both? And then really kind of thinking about that dynamic of marriage. Anything in particular that you want to say about that, Kristin?
Yeah, I would say that certainly there are different kinds of programs that can be for couples dealing with cancer survivorship types of issues. I know, like, for example, at our cancer center, they even had a group for couples that were dealing with that. It kind of varies from place to place, but there are certainly, I've seen over the last few years, especially where there's been more emphasis on this in the area of couples and working with couples and different types of programs. And then with caregivers too, may not be a romantic relationship, but maybe, you know, a parent or a child caring for someone, a cancer survivor. They're usually, at most cancer centers, there are some types of groups or programs specifically also for that, that group of folks. So it's definitely a growing area, not where I would like it to be yet, but I have seen a lot of growth. So hopefully you may have to be a little persistent in looking for that. You know, a good place to start may be if you have the cancer center where you receive your treatment, someone there who kind of handles the cancer information resources or things like that that you may be able to contact or connect onto their website.
Great. And then, Kristin, I know throughout the discussion we talked a bit about having resources that we can send along. We will, I know that, you know, you talked about some self-care plans and the like. We have specifically worksheets as well as supplementary materials that we could send along post-webinar?
Yeah, definitely.
Okay, good. So we'll go ahead and send those. One final question, and I know that there was some discussion about sort of normalizing anxiety and stress, but the point is, I think that the question is ultimately for the, that after being a cancer survivor, that it really is from that point forward maybe a lifelong journey. And so what is kind of a normal in terms of keep thinking about anxiety and management, knowing that your life might always be different once diagnosed with colorectal or cancer in general?
Yeah, I think that is that's a great question. That's a hard one. You know, there is going to always be, having, you know, gone through cancer treatment, being a cancer survivor, there's always going to be that heightened anxiety and uncertainty that people have to learn to live with, and everyone sort of learns in their own way. You know, I have heard some great analogies where, you know, this may be a better analogy for women, but men can substitute something else. But thinking it, you know, uncertainty is almost like a purse that you carry around, and you can choose when you want to put that purse down and not take it with you on those days. You know, so we do have some control over when we want to just give ourselves a break from always having to think about or worry about that. But I would say, you know, if you're experiencing, you know, you really see that sort of heightened anxiety, that's pretty normal, close to the times where you're going back for blood work or tests or things like that. You know, a lot of that's normal. That's a time where you really want to focus on some of those coping strategies we talked about. But if you're feeling like it's impacting your quality of life, it's sort of taking over your life, your day-to-day life, then that's when I would say it's sort of beyond what we think of as sort of that normal, and that's when you might want to take more action, either through your own self-care activities or maybe seeking some professional help.
Okay, very good. So I think that there's, you know, a couple of other more discrete questions that we can definitely ask, and then, you know, following up with the worksheets and all. The one other question I think that we can close out with then is in terms of thinking about being a cancer survivor and moving forward with that identity, in terms of social interactions, engaging in new groups, new activities,